Hi, Dr. Reidy. It's a pleasure to have you here. Thank you for taking the time out of your busy schedule, leading Women's for Women. We are incredibly excited to dive into your work and what you are doing. What was the original inspiration for founding Women for Women?
Well, thank you for having me. I'm really excited to be here. I founded Women for Women in 2017. And, I just wanted to mold a practice in the way that I would want to have be treated when I went to the OBGYN. I wanted to have personalized service, a lot of responsiveness by the practice, and just a warm environment when you go there, welcoming. So we kind of did a lot of things a little differently than most practices when we started.
Okay. Can you share more a bit about what your role and how it fits into the bigger picture for Women for Women?
Sure. So as I mentioned, I founded it, and then over the last 8 years, it's evolved into 9 providers, and I have sold a minority interest to one of the other doctors, so that I have a succession plan in place. I'm still the CEO, majority owner, but we involve her in pretty much any decision making.
Nice to hear that. So on a day-to-day basis, right? What does a typical day looks like for you?
For me. So I still practice full time. I do OBGYN both. I also do some aesthetics. I do Botox and filler injections and Mona Lisa Touch, which is a laser procedure. And then I'm also involved in, of course, the day to day business decisions. We do have a practice manager, of course, a team of professionals that help us, but there's always questions that come up every day. And so that's a big part of what I do. Mostly in the clinic. I do have one day a week. I'm in the ORs doing surgery. And, we also, of course, are running back and forth delivering babies.
Nice. So
So,
we heard that Women for Women is a nonprofit organization, right? For a nonprofit organization, what challenges do you typically face when you
oh,
are
it is not a nonprofit. I don't know. It's a LLC. Hmm.
okay? Okay. So from the operations side, right? What what
Hmm.
what is the biggest operational challenge that you have? Like when you are doing your day-to-day work, what are your
Hmm.
biggest operational challenges?
Sometimes it's cash flow just because we'll get huge bills from the malpractice insurance, and we'll have big bonuses due, and then we're waiting on insurance payments to come through, so they don't always sync up as well as we like. I guess that's one, especially, earlier on we had more of those issues. Um, just in general, keeping uh, the scheduling correct for everyone. That's
Mhm.
very hard for our front office to get the
Right.
right mix of everything that everyone wants. So that's tough.
Right. Right.
Yeah.
And we heard the same thing. Like when we
Mhm.
talked to other people who are independent medical practitioners, what we heard was scheduling was the biggest problem. Getting people into the office is the biggest problem after they book the appointment. And the other part of it that what we heard was getting the probably this was more about the dentistry in the dentist industry because
Mhm.
getting the uh, patient information from the insurance, that's the most waiting part of it. Like the doctors were not back to back working because you always have to get to the insurance and get their deductibles, get what's left out of their insurance. Is that the same problem that you face as well?
Well, there are some challenges with OB in that regard, in that right now the insurances don't pay until after the baby's delivered. So all of the prenatal care, everything that we do those 9 months is, on hold. We don't get paid for any of that until after the baby's delivered. And if the patient has a responsibility of, say, $2,000 to $4,000,
Hmm.
we try to get them to pay that early in the pregnancy. That way, once their baby, a lot of times once their baby's delivered, they don't want to pay us $4,000. So that's, that's a bit of a challenge, but most of our patients understand that, and they know they'll get a refund if we don't use all of their deposit.
Oh, that's great. And if you have to let our audience know, what is the biggest misconception people have about the work Women's for Women do?
Mhm. Um, I guess there's several misconceptions. I mean, we are a full scale practice. We do a full on aesthetics service, and we have also a menopause provider. We have midwives who do delivery, certified nurse midwives. A lot of patients have misconceptions about that. Um, but a lot of the older patients think that we're really only interested in delivering babies, and that's not true.
Right, right.
Mhm,
And in your day-to-day operations, right? If you
mhm,
could automate one process in your organization to free up time to make more impact to the patients that you are working with, what would
mhm,
that be? Like any process that you could think of that you could automate or delegate, or somebody else take care of it, and
mhm.
you can spend more time on working with the patients rather than the operations part of it. What would it look like?
Gosh, that's a great question. I mean, there are problems streamlining patients' check-in and then getting them to their. A lot of them have an ultrasound before their visit with the doc, so that is booked now as two separate appointments. They have to be checked back into the physician after they've had their ultrasound. So streamlining all that would be wonderful. Um, and then as far as, myself charting on the chart, it really is going pretty well with that. But, a lot of times we have issues after they've gone with the coding, not matching up to the orders and things like that. So that's billing people have a lot of extra work doing that. Yeah.
Right, right. So we hear the same thing from other providers as well, where they say that putting the right codes in for the insurance, it's always like comes back
Hmm.
with declines, and you have to code it a separate way or a different way to get that
Hmm.
billing. Is that the problems that you see most?
Yeah, I would say that's a big problem. Hmm.
Right. How about scheduling, follow-ups on scheduling? Do you see that any automation process that would let you schedule, have that connect with the patient? Let's say a reminder before, or an email sent out, a personalized email sent out to the patients. Would that help to retain the people? Because general industry trends that we are looking at was the people who booked for an appointment and who gets it into the hospital is 20 to 30% less, because they just forgot the appointment. They don't want to
Hmm.
do that follow up, or some sort of impediment that's not getting you there. So do you see
Hmm.
anything that
I
helps?
actually, our practice has a very low, like, no-show rate. We
Uh-huh.
do quite a few reminders. So I think that helps a lot. Especially the OB patients, they're happy to come to their appointments and hear their baby's heartbeat, and so they're not dreading the appointment like you do for some other things. Now the annuals, sometimes they'll reschedule several times, but as far as like just no shows, it's not very often.
Right. Where do you see that probably an artificial intelligence kind of a work helps as part of that coding structure? Like, do you like you work with the same insurance companies or the same set of insurance companies mostly, right? Do you
Hmm.
think automating that and have somebody review that whole coding process, right, where you are putting that work to the code, uh, will that help you guys, like making it an automated way so that you're not keep on second guessing what you are doing?
Yeah, I haven't seen that yet, but if that's a possibility, I would think that would be helpful.
Right, right. And do you outsource those kind of work, or do you have people, somebody work with you within your office to do that?
We have several people work for us. We did early on outsource when we were smaller. Our EMR system is Athena Health, which does do a lot of the billing for us too, but there is still a lot of work on our end that needs to be done. So, but we don't outsource it. Sometimes they work from home, but that's different. Yeah.
Yeah, yeah, that's different. Now it's a very common thing in the industry that
Mhm.
people who can work from home should work from
Right.
home.
Yeah, save space for sure.
Right, right. And we know that you are in the OB-GYN part of it, right? So
Mhm.
where do you see that women health would be in the next 6 to 12 months, or let's even say farther, right? Like 3 4 years. Like I think people are more receptive of going to the doctor's appointments, having their annuals done, uh,
Mhm.
which is not pretty common. Like 10 years before, it was like
Mhm.
it's one of those appointments that you want to go or you don't want to go, right?
Right.
But I think the people are changing now. They wanted to get their annuals done. And how is that push happening, Dr. Reed, that the annuals are part of your insurance coverage, so it's not going to cost you much. But how is that push working?
Well, we do have a lot of times troubles getting them all in who want to come for their annuals. Our which is a good problem to have. I mean, we have backlog of patients wanting to come in that are already established, let alone new patients. So we are working to add more providers, but we're running out of space currently. We're going to be building a new office over the next 2 years, and in the new space, we'll have room to be as big as we want to be. Mm.
Nice. That's
Yeah.
yeah, like you said, that's a great problem to have.
Yeah.
So right now, we saw that you have only one location, right? And looks like you are planning to expand. So are you still like holding it to the same metropolitan city area, or are you planning to expand more than that?
For now, it's just in Huntsville, Alabama. I could see easily it being something that could expand to other cities because we have a very definite brand, a definite mission that people identify with that could be carried out in other places.
Nice. We have gone through the testimonials that patients give. They are very different than what you generally get out of the other hospitals or the other caregivers. So, what is that you do special as part of Women's for Women that we see the kind of reviews that we are seeing on your page?
So we try to make sure that we invest in all our employees in their growth as people, their growth professionally, and so we have employee retreats at least 4 times a year, and also other like more social events for the employees, so that we develop our teamwork, and that's very popular. I think that that really helps with employee retention and also buying into our um, our ethos, which is just to treat everyone like they're a VIP. And so that means if they message us on our Athena, we message right back. Um, if they need to come in, we try to get them in. I mean, if they ask for a special little thing like an extra ultrasound, as long as they understand they might have to pay for it, we can usually accommodate an extra ultrasound too. So I just think that's different than a lot of other places. And then the actual, like I said, the physical aspect of the office, we have a lot of natural light. We have all original art, more modern art, not like traditional um, stuff that you would see. And then just the calm coloring, like just like soft grays and things like that. It's just more inviting atmosphere.
Right. Right. And you said as part of your app that you reach out when they message, right? Do you see any automation in there that helps you where you have a set of questions that you always get, and you see how in general the Google search changed with your questions? It's more cohesive answers right now rather than pointing you to the links, right? So do you
Right.
see anywhere that automation can help where you are delegating most of the work where the system itself responds to the patients? But again, whenever there is a blockade, then your staff will take over that conversation and have uh, that personal touch added to it. Will it help?
I suppose right now it suggests things to respond to the question they're asking, and with very general recommendations. Um, Patients are pretty demanding, and they want like specific, tailored things to them. And so I don't know if it's going to be that helpful, but we'll see.
Right, right.
Mhm.
And in general, right, with healthcare information, there is a lot of HIPAA compliances that you have to go through. There is a
Right.
lot of you cannot just pick and choose whatever you want as part of your software providers or your overall process. How does that all fit into your system where you're currently working in?
Well, we have, luckily Athena is pretty covers, billing, scheduling, all that. So that's pretty comprehensive. We have a specialized IT company that helps us with any kind of software issues that we have. Even if it's with Athena, they'll help us interface with them. Um, we also have another like kind of hardware company that services all our machines. So they just kind of all work together.
Mhm. That's nice to hear. Now talking about more about the patients, right? The
Hmm.
demographics of the patients that gets to you and the way of interactions that you have with them. Do you see them happy when they leave the office that they know more about their health, or do you see like one more checkbox that they're doing as part of their health checkups?
I hope that they're happy, and what we they do get a text to give us a rating, and we get a lot of
Mhm.
5-star ratings. If we get a low rating, we look and see what we could have done better. But by and large, I think they're happy because they come back.
Right, right. So as part of this health provider network, or you're doing it on your own, but what do you see that's changing in the next couple of years? Is there any change that you're seeing that we wanted to know about, or is it going to be what we are doing right now?
You mean in general or with Women for Women? Mhm.
In general and with Women for Women both.
Yeah, in general, the biggest thing that's coming down is in 2027, they are going to stop bundling all the OB service, which is what I described originally, that you didn't bill until the end of the pregnancy after delivery. Now we're going to be able to, that's what we're told, we're going to be able to bill as we go along for the ultrasounds and the visits, etc.
Mhm.
Which is going to be helpful because people move very often in the middle of pregnancy, and so it
Right.
makes it difficult to get paid for what you've done so far, or when someone comes in at the end to your practice, it's been difficult. So that's probably the biggest change that I see, business wise, for women for the practice in general.
Mhm.
Women for Women, like I mentioned, we're undergoing a big period of growth. We have two physicians probably joining within the next year, and then at least one or two more um, within the next few years. Mhm.
That's nice. And I can
Yeah,
relate to that problem because we moved when my wife was pregnant. We
really.
moved city to city, and it
Hmm.
was very hard to find a provider when you are like 6 months into your pregnancy. Nobody would
Right.
like to take them. And we literally have to work with our insurance to get to a provider, not even our
Wow.
choice.
Yeah, that's hard.
Right. So you're saying that that part is moving away so that you can bill each individual visit as its own visit.
Yeah, that's what they're telling me. I have my billing person doing an economic analysis of that, like whether we'll
Mhm.
actually get paid more. Um, of course, the hope is that we'll be paid more, but
Right.
we'll see. We'll see.
Right. And how does this work, Dr. Reed, that if you have to research on on what's going to happen, is it the general research, or you go to the government websites and get more information from there, or is it the insurance driven or a government driven mandate that's coming through?
Since most of our patients are privately insured, and we have a very large segment that are Blue Cross Blue Shield, we would
Mhm.
start there with the research.
Okay.
And then, yeah, we do have, especially for the midwives, they have a Medicaid population, and so we would go to the government ones for that.
Right. But the mandate that you're talking about, is it
Mhm.
like insurance providers driven or the government driven?
I think it's insurance provider driven, but I'm not sure about that. It's a good
Right.
question.
Right. Okay. Okay. And anything else that you wanted to talk about? What Women's for Women is going to do?
Mm. Well, yeah, we just added a third person in our aesthetics group, and she's an
Uh-huh.
RN. So we're going to be able to offer more medical procedures. For instance, if a patient has a problem with like nausea and vomiting from pregnancy, you should be able to do IVs for those patients and give them IV fluids. She's going to manage our weight loss clinic for us as well. So I see big growth with her coming on board.
Thank you. So looking ahead for the next 12 months, right, if you could solve one single problem that would increase your capacity to serve. I know you already have that problem to serve more people, but you don't have enough people. What would that problem be that you wanted to solve from the operations side that you can? I mean, I know you wanted to add more people or more providers to your and more location for the space and everything.
Hmm.
But if you are ready to add more people and if you wanted to serve more people, what would be the from the operation side that you wanted to do that would help you achieve what you wanted to do?
Hmm. I mean, the rate limiting step is the space and the parking that we
Mhm.
have currently. Um, then the next thing would be probably having people streamline, getting those people onboarded. It's really difficult to get them uh, authorized with all the different insurance programs that are out there that we take, and then
Mhm.
of course all the hospital privileges, the licenses that are involved. It's quite a bit for each provider, and then as you stay there, you still have to renew all that pretty frequently.
Right. Right. So are you planning to do any outreach in the community to get more people because you are adding more space, or you think that what the people that are coming through right now and the capacity that you have is solving that problem?
Um, do you mean like employee people or patient people?
Patient people.
Patient people? Oh, yeah, there's a shortage in Huntsville right now of OBGYNs. And
Uh-huh.
so, yeah, there's definitely not going to be a problem getting them busy. The As far as the aesthetics, we do a lot of social media um, publicity and advertising through that for them, since that is cash business. It's different. Um, as far as the midwives, the community that we're in, and I think it differs from some cities to cities. A lot of them are very interested in a very low intervention birth plan, and that's what they specialize in. So we see their schedules fill up pretty quickly.
Nice. Uh, I think that's all we have from from today.
Okay. Yeah.
Thank you very much for
Mm,
reaching out.
mm. It's been